Hi, I'm your host, Marsha Florence with Just Ask Podcast and Just Ask Live. I'm sorry, Just Ask Talk Show and Just Ask Podcast Live. Thank you, ladies and gentlemen, for tuning in because you know how we do. When you come on to the air to see me, that means we got some resource for you. So, you know what? It's a couple of months into the new year, and a lot of things are going on. So we always have try to research some things for you to get involved in or utilize in the beginning of the year. Now, a lot of you may not know it. In the beginning of the year is the best time for you to do your research for your home repair, your college kids who are going to getting a good job for the summer, or your high schoolers for the summer, your insurances, renewal, replacement, whatever you need to do. So a lot of stuff that you need to address, ladies and gentlemen. We do our best to get that out there to you or just give you food for thought so that you can be prepared. And you can always, just reach out to us directly or reach out to me, Marsha at justasktalkshow.org, and let me know what your concerns are or if we can do a show, information that you think is noteworthy to share with our viewers. All right, now you know me, I always got something good coming down the pipes. And so I always like to have some of our returning guests come in and give us some insight on things that you may know a little about or just got questions. Okay, so it could be anything. So today we asked our dear friend, Mr. Rodney Ross of Ross Insurance and Advocacy, to join us because you got questions. So I don't want to hold up the line with my conversation. So let's go on to introducing you to our returning guest, Mr. Rodney Ross. Hey there, Rodney Ross.
Good afternoon, Marcia. How are you today?
I'm good. I'm good. Glad to see you, Rodney.
Likewise.
Now, I always tell our viewers when we have returning guests, that's because it's got some good information and resources that, some people may be needing some support and clarification on. And so, Rodney, I wanted to, ask you today, if you don't mind. I had a couple of phone calls from somebody asked me, what's between Medicare and Medicaid? And I thought I knew it, but no, I don't. So I said, let me ask our dear friend and colleague Rodney Ross to fill in the gaps so people can get a better understanding from the expert.
Thank you. So
Okay.
here's the biggest difference. The biggest difference is this. Medicare, you are eligible for Medicare because you either turn 65 years old or because you are receiving a monthly Social Security disability check. That, and you're under 65. Medicaid and Medicare, you do not lose your Medicare eligibility. You do not lose it. Medicaid, different story. Medicaid, that is something that people are able to get based upon meeting financial eligibility. Really, it's a matter of in Michigan, you have to have a monthly income of $1,100 a month. You have to be living off of $1,100 a month. That's the threshold for qualifying for Medicaid. And you can lose your Medicaid eligibility if your income increases. It's so sad, but thousands of people every year they lose their Medicaid eligibility because they get a increase in their Social Security check. So everybody gets a 2% increase in Social Security. Someone's check goes up by $11.35, and that
Hmm.
puts them over
Okay.
the threshold,
So
and they
what is the
lose their Medicaid
but
assistance.
I'm sorry, what is the threshold? Is there a set cap, a threshold amount?
So in I don't know what the 2026 dollar amount is. 2025, it was roughly if your monthly income was $1,100, you were not eligible for full Medicaid benefits. Full Medicaid benefits means that you have health care to cover your your health,
Hmm.
full health care paid by the state of Michigan.
Okay. Okay. So now we know that, people can have both.
Correct.
Okay. So in having both, that means their income is at a certain level in the guideline.
Correct. So to have both, that means that a person, they qualify for Medicare either because of their age or a disability,
Hmm.
and they have a low income.
Okay.
And the low income qualifies them for Medicaid. And there are specific Medicare plans that are designed for people that have both Medicare and Medicaid. And those are the plans that are blasted all across the TV screen. People see $2,000 a month, $200 a month. No, all these advertisements to get people's attention to make them call
Mm-hmm.
and talk to 800 numbers, and only to find out that they don't have Medicaid. So that particular type of plan is not available to them. But for persons that have both Medicare and Medicaid, and they enrolled in what is called a dual eligible Medicare Advantage plan, those plans are rich in benefits, and they're rich in benefits for this reason. We're talking about a population of people that imagine you're living off of $1,100 a month. That's for your rent. That's for your groceries. That's for everything in your life. So on those plans, that's where the carrier provides a debit card, either
Okay.
Visa card or
Mm-hmm.
a MasterCard that may have $200 a month that the person can use
Mm-hmm.
to buy various things. They can use it to get healthy food. They can use it to purchase gas at the pump at a gas station, to pay their cell phone bill, to pay their utility bill, as well as for healthcare. Now, I know there are some people that they get real salty about why they get all that. Here's what I say to people. You can get that too. Take your $45,000 income and take it down to $1,100 a month
Mm-hmm.
and pay your rent, pay your mortgage, pay all your bills off of $1,100 a month. So if you start living off $1,100, you then qualify to get $200 a month.
Okay. 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 Well, there is a couple of health insurances that don't give out those extra perks, such as the gift cards or, the
Mhm.
monthly program that you're speaking of. And but I think it's a good thing to allow people to know that there is some additional support when you are dealing with a lot of these different healthcare agencies. And if you don't know, if you don't ask, you don't know. So on that, what I mean is that if you get a chance to find out if you can get transportation coverage, if you can get like groceries, if you can get medication waivers and stuff like that, we need to
Mhm.
ask those questions because even though you don't use a benefit sometimes, Rodney, it's almost like they got paid for a whole year and you didn't use it now once. Now, I believe in going to get my eyes checked, going to get my ears checked. I mean, everything you're supposed to get checked, ladies and gentlemen, you need to get
Yeah.
checked because each year these benefits that are allotted to you, you're only using that gift card or whatever that comes, the little stipend.
Yeah.
But what about the overhaul medical to make sure that you're okay, that you're doing well? That's my main concern.
And when you speak about that, Marcia, Medicare Advantage plans, when you hear Medicare Advantage plans, here's what that means. It's a Medicare plan that a private insurance company is providing.
Mhm.
Private insurance company, that's Blue Cross, Aetna, HAP, Humana, only to name a few. Those are private insurance companies and they sell Medicare Advantage plans. The government requires every Medicare Advantage plan to have screening benefits. That's what you're talking about.
Mhm.
Benefits where you can go in and get screened for certain conditions before the condition actually makes itself present in your body.
Correct.
And these screenings, they all have a zero out-of-pocket cost. There's
Mhm.
a zero copay, and there's roughly 30 some screenings that are required by every company to offer to their
Mhm.
members.
Mhm.
One of the things that myself and our team we do when we're talking to people on Medicare, we closely walk through each of these screening benefits and we explain to them it costs you zero. And
Mhm.
I also explain the reason that these screenings are important and why the government makes them a part of every Medicare plan is because not that they like you, but it's a dollar and cent thing. Everyone in the medical profession understands If we can catch something before it gets deeply embedded into your body through a screening test,
Mhm.
it is so much less expensive and easier to treat. And the potential of you surviving is greatly increased. So these
Correct.
screenings, there's a reason that the government requires these companies to provide these zero cost screenings because we have a population of people, Marcia, that is sad to say, they use the emergency room for their health care because they don't have a primary care doctor.
Hmm.
They don't go to doctors. They just know when they don't feel good, when they feel like they're about to die, that's when they go to the emergency room. And that's just a real sad dynamic, particularly in underrepresented communities
Hmm.
where minorities are the larger part of the population, and in rural communities. Rural communities are just as hard hit when it comes to access to health care.
That's true. And Ronnie, we having this conversation because, excuse me, our job, both of our jobs, is to educate the viewers to, do better for your health coverage. I mean, I always tell people, you tell your children drink water, brush your teeth, this and that, and then you don't drink water, and now you got kidney disease or kidney failure.
Yeah.
You don't drink water, you don't brush your teeth. Okay, well now you got get your teeth pulled. So how are we teaching our children things that we don't even apply to ourselves? Is new to me. I mean, I'm looking at it like whatever I'm supposed to do, if I'm passing it on to my children looking at me as a role model, and I need to make sure that they are aware of the good qualities of how to take care of themselves, hygienically, health wise, overall, period. Instead of just like, well, my dad, he didn't do that. My mom, she didn't do that. Don't do that, ladies and gentlemen. Do well for yourselves so that your children can live here longer with you or spend more time with you in life. Now, Ronnie, I say that because there's a lot of confusion between people when you say Medicare and Medicaid, but Medicare Advantage plans have monthly premiums low as $0 and as much as 300. What is that?
So let me address that, but I want to say one thing first. There is many people, they don't have health coverage or they don't use their health coverage
Mm-hmm.
because here's what they say. I don't understand that Medicare thing. I just don't understand this whole Medicare. Well, our our team, myself and our team, our mission is to help people understand Medicare. Matter of fact, we tell people that we work with that our goal
Oh
is to
my.
make Medicare as easy to understand as a Dr. Seuss book. People that I grew up with, they know green eggs and ham. My
That's
name is
right.
Sam I am. I
That's
eat
right.
green eggs and ham. And that is how we make Medicare simple. We simplify it. It's
Okay.
nothing but a health care plan. That's it, nothing more. Now, there are perks that are added to some of these plans. However, end of the day, it is a health care plan for you to be able to see the doctor, go to the hospital, have tests done, and you have an insurance company standing behind you to help pay the bills.
Correct. Correct.
That's it.
Correct. Hmm. And you know what? So now, if you have a deductible, people fall out the window about deductibles. I mean, I every time I go to the doctor, it's $20. I got $20, ladies and gentlemen. I'd rather have $20 than $200. So,
Mm.
we wait till a bill sounds crazy, like, oh, that's a lot of money. Even when you get your prescription, where you say, well, why am I paying $10 for my prescription and I got prescription coverage? But if you actually look at the bill and you see where it's $90 and the insurance company has taken the first 80, that's why you got $10, you wouldn't complain. But if they just gave
Yeah.
you and said you don't have any insurance, ma'am, your medicine is $90, I can understand you having a problem with that.
Yeah. So let me address your question about Medicare Advantage plans and the premiums,
Mm-hmm.
a $0 premium or $300 premium. Um, Private insurance companies got into the Medicare business 23 years ago. One of the things that the federal government told the private companies was this: when you start creating your Medicare plans, you have to create some plans that everybody can afford the monthly premium.
Mhm.
So what's the dollar amount that everybody can afford? $0. So people say, so Rodney, the plan that costs $0 a month, it's not as good as the plan that costs $300 a month, is it? Wrong. It is just as good.
Mhm.
But it doesn't have the same things, same features, does it? Yes, it covers the exact same benefits. Whether a Medicare Advantage plan has a $0 premium or a $200 a month premium, it covers hospital, doctor, prescription drugs, dental, hearing, and vision benefits. And it probably also has a gym membership that you can use for either one or two things. These Medicare companies, they don't provide gym memberships for people, for their seniors to go get buffed up, lifting weights. Really, it's a matter of providing a social outlet for their members to be able to socialize
Mhm.
and to
Mhm.
try to stop or pull back the degree of isolation that many seniors have.
Okay.
No place to go, nothing to do. A, and at these gyms, they have programs designed for seniors,
Mhm. Mhm.
not lifting weights, but programs to get people to interact. And interaction is healthy, isolation is not healthy.
Correct. Right. Engagement
So,
is
so
always a positive.
absolutely. So
Mhm.
the plan that has a zero premium, it is as good as the plan that costs $300 a month. It is
So,
as good as. It's not watered down. You're not getting less. You're getting the same product, the same benefits. The primary difference is your out-of-pocket cost, your co-pays will be
mhm.
probably higher by a couple dollars between the two plans, but you'll still have the same core benefits.
Okay.
And Marcia,
Okay.
what you were saying about use prescription drugs. Let's talk about healthcare overall. Here's the concept. Instead of us having to write a $98,000 check because we went to the ER, because ER visit, it can very easily be 50, $75,000 visit. The doctors, all the equipment, everything that they have, that bill can be huge. Instead of us having to pay huge bills, we have insurance. And the company that we have insurance with, they pay the big part of the bill,
Mhm.
but they don't pay the whole bill. It's not free. We don't have free health coverage. But health plans and the companies, they pay the lion's share of our benefits, and they leave us to pay what's called the copay or the
Mhm.
coinsurance,
Okay.
which is if you look at the bills, most people don't, you'll see that what you're asked to pay is really small in comparison to the total bill.
Mhm.
And that's for all services, prescription
Right.
drugs, hospital and medical services from doctors.
Yeah, we have to start reading the materials that come through, in the mail. Like that, is it the yearly book that's out already? I know it's a
Uh,
yearly book that comes.
are
I haven't
you
gotten
talking
mine.
about this book?
That's the one, Medicare
Yes,
You.
yes,
That's
yes.
the one.
And
Now, Rodney, is that book automatically sent to clients, or they have to request it?
so supposedly Medicare mails the book to every Medicare
Okay.
beneficiary every year. Supposedly. I talk to more people that don't have the book, haven't seen the book. Now, when you put something in the mail, you're now trusting the post office to get it to people. So I'm not sure that the government is responsible for people not getting the book because they're not directly delivering it. They put it into the mail. People move, people's stuff gets lost, blah, blah, blah.
Well, do you
But yes,
call and ask for the book? I mean, because I know
no.
I've had the book before, and I don't remember getting the one for this year. So, do I need to call and ask for the book, or are you saying that's the automatic mailer?
So if you don't get the book, yes, I recommend that you call if you
Okay.
don't get the book because you can order it and they will send it to you. They'll mail it to you like they supposedly mailed the first time. Now,
Are you telling on
I've
these
heard
folks?
two.
Okay.
I've heard two different things about the book. I've heard that at some Social Security offices, you can get the book at a Social Security office.
Hmm.
I've had some
Yeah.
people tell me that they've gone to the Social Security office and they were told, oh, we don't have that anymore. So I
Wow.
don't know, but you can absolutely call the Social Security Administration 1312.
Okay. Say that number again.
800-772-1312.
Okay. That's what you get for telling us off the top of your head. But we got it. We got it. Okay. So, and then you know what? Also, can't you call your insurance carriers and ask them to send you the book? I think Blue Cross Blue
No,
Shield sends the book to me or something.
no. So this is a government publication.
Okay.
So it's the government that actually sends the book out. Medicare, the
Okay.
Center for Medicare and Medicaid Services, CMS, they send the book out.
Okay, so I'm gonna ask you right quick because you know a lot of people say, "So what's the big deal about the book?" Now I kind of know, but would you elaborate just a little bit about what people can find in that book? Because that's a good book.
They can find 90%, the answers to 90% of the questions that they have, they can find in that book. Now, whenever our team works with a person, first thing I ask, do you have the book? If they say yes, that's awesome because I like, and what we do, we answer people's questions using the book because two reasons. When we're answering questions and the answers in the book, the person knows where the information is coming from. They're not having to trust, does Rodney or our team know what we're talking about? We're simply reviewing the information that is in the book that the government published and sent out. That's the first reason. The second reason is if we use the book, the person can hold on to the book and be empowered to know where to go when they forget the answer. They go back to the book.
Okay.
When a person has the book and we're meeting with them face to face, we highlight stuff for them. We fold pages over in the book to make it easy for them to reference back to if they want to find it in the book versus no giving us a call.
Okay. Hold that book up again, Rodney, because that a lot of people probably who are tuning in a little late, they want to see that Medicare and You 2026 copy. And you said that you can contact the Social Security Administration and get that book.
You
Okay,
are
because
correct.
I've had the book before, but I don't think I've got my new copy. So I'm gonna reach out to him this afternoon,
Yep.
okay, and find out where's Marsha's book at. But I am very knowledgeable in that book as well because if you're looking for a specialist or whatever have you, you can look in that book and see if your doctor is in that book as well, and what percentage of medical care would be covered under that in the book.
A lot of information. And like I
Hmm.
said, the book is going to answer, it has the answer to 90% of the questions
That's good.
that people have about Medicare and how Medicare works.
That's good. That's
I can get you! No, you're not! Hey, it's your turn to hide now. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Here I come.
Even more than I wanted a gold medal, I wanted a heart of gold, like the mentors who were my balance beams refusing to let me down, and the coaches who spoke out to anything out of bounds, heroes who never stood on podiums, but stood up for me. Every shot I made, give the assist to those who since my youth were referees, ready to blow the whistle and end abuse.
good. You know what, Rodney? The whole purpose of Just Ask is to educate people and about the rich resources that we have here in the state of Michigan and beyond. Because I always tell people what goes on here, the names may change in another state, but the resources is the same. You just got to know the name of it in your state. But most of the resources that we talk about, they're all the same. And whenever you move from one state to the next, you always want to go ahead of time be educated on what it is that you're looking for. So if you're a diabetic, you want to know where all the diabetic businesses or dialysis. I say you want to know where the hospitals are, the clinics are that have diabetic dialysis treatment before you actually transition to another state, so you can be better prepared. So the knowledge that you provide for us, when you stop by and see us, Rodney, is very insightful, and people learn a lot. And I'm just so grateful to have you, come by and join us periodically and tell us some good things that's going on. Anything else we need to know shortly before we wrap up? Because you always got something hidden up your sleeve. Let me see. Any questions we
So,
need to have answered?
so sure. Medicare, Medicare is a year-round thing. Medicare is not just in the winter time, October, December. People are turning 65 years old every day. I recommend to people, if you are leaving a job or turn 65 and your employer is not going to provide Medicare health plan for you, find yourself a licensed broker that will work for you. And that is not a 1-800 number.
Okay.
The worst thing, in Rodney's opinion, the worst thing that a Medicare beneficiary can do is talk to somebody at a 1-800 number. It's a person that you don't know where they are, you don't know if the information they're providing is correct or accurate, because they're just talking to you on the phone for an hour and a half, and you have nothing to reference yourself. So that is, in my opinion, and our team's opinion, the worst thing you can do, because you're not going to get personal service. You're not going to
Okay.
get a team behind you.
All right. Well, you said a mouthful there, and I'm hoping that our viewers would take heed. So, Rodney Ross, will you come back and join us again?
It'd be our pleasure.
All right, Rodney. Thank you so much. Hold that thought for me, will you? Okay. And now, ladies and gentlemen, before I go, I have to bring up Mr. Rodney Ross's flyer, Retired Care. So if you guys got questions for him, you see the number down below, the 586-393-ROSS, as well as you see his email address. So any questions that you have for Rodney Ross, feel free to call him directly, or me, I always tell you, you can give me a call, and we have additional numbers as well. So our number, 1-800-323-5336, and locally it's 248-242-7730. Now, we know a lot of people say it's the 800 number. So, okay, we have two numbers, and we answer on both lines, so it doesn't matter, okay? Whatever number you want to use, we're going to answer that phone, okay? So definitely give us a call and reach out to us and let us know what your thoughts are. So I'm your host, Marshall Florence, for Just Ask, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask. Just Ask. I'm your host, and what I always tell you, see you next time.